Good morning, everybody. Dr. Stavros here. How are you? How are you? Let's see. Give me a second. Here we go. Happy Tuesday, May 1st, the beginning of the month. Nice to all be together. Just had my live session with all my med students. We went over microbiology. Now, I know a lot of you sign up and follow me because you're in step 1, step 2. You just like hearing me talk, right? Either way. It's great because with social media, we're able to connect with the world, right? Which is nice. It's actually pretty awesome. So that's why I say to myself, I want the best for you all. I want to make sure you guys are all comfortable and understand that it's very, very easy to study for this test. If you have the right technique, if you have the right navigation, the right mentor, the right guidance, right? So we always talk about resources. So today I want to discuss a little bit about ideally about microbiology because in med school, if you're a medical student now in med school, let's say physically in microbiology, or you're a practicing physician that you want to actually study for STEP, micro is at the beginning of your medical career, right? First, maybe second, third semester. So microbiology is something you don't hear often talked about. You hear physiology, pathology, physiology, path pharm, pathophys, right? You don't hear micro. Why would you? But micro is something where you can get so many points. It's ridiculous. It really is. It's a lot of points when it comes to STEP. Because think of it this way. You have bacteria, viruses, fungi, and parasites. Okay. All that section, all those subtopics are testable. Plus you have pharmacology, antibiotics, antivirals, antifungals, antiparasitics, right? Yes. Many of you are familiar with the information, but not really familiar with the details. And that's why you have to understand it's important because you have to know the information, right? And then what happens when you get to organ systems, heart, lungs, kidney, and so on, you are tested all the time on those details. For example, strep pneumo, strep pyogenes, Clostridium difficile, many things that come your way. And a lot of students that I work with one-on-one for step 1, for step 2, they at the beginning do admit that it's a lot of information. So I realize when I do these private tutoring one-on-one sessions with coach for so many students and also with our live sessions, that once you start getting to a rhythm, you feel good, you feel great, and you actually feel that you're understanding the material, right? So please ask questions. I'm here live. I want to bring up a couple of probably a scenario or so on Amboss so I can show you guys what you can absorb from this, because a lot of students have issues, and maybe yourselves have issues with studying. It could be the content, it's a lot, questions, a lot to answer. Details are difficult to obtain and remember and recall. And that's why with techniques and ways to do it, you can understand. I mean, just yesterday I had 2 students for step 2 CK. One was one-on-one consultation. One was I'm teaching also step 2, usually one-on-one coaching. And he was a great guy. And he goes to me, yeah, I watched your session last week. I was on a live stream like this. And I realized that out of all the coaches out there and the noise that happens, there's a lot of courses, a lot of people that know hopefully what they're saying. I just have a passion. And I know, for example, that, when you reach out to me, whoever reaches out to me, I can help you, whether I can help you in a live setting, whether I can help you with a group of many that we work with, or just give you some advice that allows you to have some understanding of how to proceed forward, right? Proceeding forward is important because a lot of you guys are wasting valuable time. And what happens is it gets annoying after a while. It gets annoying. If it gets annoying, it sucks, right? So ask questions, please. Let's see if you have any questions on board. Let me see if there's any questions pop up. I'll just put that stuff right there for you. That's basically links that I have. Hopefully it works. Yeah. So these are links that I have for the consultation, also for the one-on-ones, live sessions and all that. I'm here to help you guys. I'm here to help you guys push forward. You could always reach out to my team anytime. Clearly, you guys know that I'm always available for you. So think about exactly what's happening when you're studying, right? A lot of students always ask me, they go, How do I learn microbiology? What do I do? A couple things. I would suggest Sketchy. I would suggest online med ed. I'd suggest using those resources to help you. Bacteria is very, very challenging. Viruses are very, very difficult. And what happens is many people feel overwhelmed with the information. Because of that, it gets difficult. It gets very, very difficult. But it's okay, because the reason why is I'm here to help you. I'm here to navigate, and I am real. I promise you, I can help you guys every step of the way. Trust me on this. Whether you want a one-on-one consultation or you just want to jump on and watch me talk about a few things, I'm here to help you guys every step of the way, right? So I'm going to show you something. So I have a question that I want to bring up. A student was asking me actually this morning on my live session, so I wanted to share it with you, right? Let me see if I could share here a second. Let me present. Let me see. Share screen. Oh, yeah. Here we go. Give me a second. Let me share it. Okay. So this is the screen. There it is, I think. Yeah. So this is the screen that I have. Let me see if this works here well. And this is basically what I have here as far as my bacteria question. So what I have here is this. This is the scenario that we did today in class, right? And, I want to show you, because whatever you're doing as a step-by-step presentation, you have to understand a few things. I use Amboss because with Amboss, I can simply share my question or links of sets that I create for my students to other students and physicians that have Amboss account. So if you need help learning how to study and what to study, I'm here to help you. That's A. B, they have great ways to learn how to attack the scenarios. And C, it's not just a QBank, it's more than that. They have a huge amount of information, vast amount of articles, and you just go to the search engine here and type in CHF, boom, click it, and it opens up to large amounts of articles, literally a one-stop shop, right? Okay, but this is what I do. To take some information from this, I'm going to show you something, right? This is microbiology at its finest. A little tip, a little inside tip of what you got to do. If you see the scenario, it's only a couple of sentences long. This is just like an NBME length of a question. The actual USMLE is a lot longer in length, right? Look at the answer choices. You have A, B, C, D, E, F. If you want to know if you know micro well enough, you should test yourself and say, okay, look at the answers, A and B. Can you tell me, or can you put in the chat, say, what is F? Protein A. What organism has protein A as a virulence factor? Virulence factors are important to know. A bacteria has protection against our immune system. They have certain things to evade our immune system. Yes? Yes. So protein A, I don't want to give it away, but one organism has that. Toxin B, for example, another organism has that. So if you don't know the answer choices, how will you be able to answer the question? Just like if you go to the hospital today and I say, doctor, you say, yes, Dr. Stavros, I want you to go see patient in the first room. And I give you a list of differentials. There's 7 of them. Okay, so you have to walk in, ask questions to the patient, come up with an idea of what he might have. But a lot of times it's not easy. So if you know how to knock off that list of differentials, it becomes easier, right? You're like, doctor, yes, I don't know what he has, but I know what he doesn't. What do you mean? Well, I have a list of 7 differentials. I can knock out 6 or 5 because I know it's not possible. So I'm down to 2. That's how medicine is in the hospital usually. It's either you really know what the person has, or by exclusion, you're like, you know what? I know what he doesn't have. And then I do more tests and so on, so on, so on. So to know if you know your microbiology, you should be able to tell me at least some of these. Now, that being said, I will read the scenario out loud. This is what I do, not only in my live sessions when people can interact with me live and ask questions, but in my QBank video library, this is what we do. We add questions like this to our library that keeps expanding and keeps growing. So then when you're home using UWorld, Amboss, Kaplan, Bootcamp, whatever QBank you want to use, You could use my video side by side so I can show you the techniques and ways around certain questions, because there's only certain style of questions that USMLE has to offer, right? Question from IMAJ. Good day, doctor. What's the best way to remember investigations for microbiology? Not sure investigations what you mean. Elaborate more about that and I'll let you know. But microbiology, like we talked about before at the beginning of this live stream, there's different resources you could use. All right. Amboss has it all, by the way. It's a one-stop shop. So if you don't believe me, try it out. Take a look at it. You could do a trial and see how wonderful it is for you. So look at the scenario. I'm going to read the scenario like I do with my students, because a lot of students have problems with this specifically. They can detect the bacteria. They just can't detect the virulence factors. So it sucks because they literally spoon feed you the condition. They lead you to the answer and they go, what is their virulence factor? You're like, I know it's this. I know it's E. coli. I know it's TB. I know it's sarcoidosis, but I don't have the little piece at the final piece of the puzzle. And because of that, they make you feel stupid and you fail. You're not going to do that with me because I'll show you the tips and strategies when you use my QBank video specifically, where you jump on these live sessions what I have Tuesdays and Thursday mornings, right? Okay, check this out. Read the last two lines like I always tell you, last 2-3 lines. The wounds have a sickly sweet odor. All right. Culture of the affected tissue grows an aerobic gram-negative rod. So sickly sweet odor, aerobic gram-negative. Maybe some of you know the answer. If you do, put it in the chat right here. I'm going to put a smiley face there. Put that in the chat if you have an idea of what so far the condition could be. Some of you do, some of you don't. The causal pathogen most likely produced which of the following substances? All right, so we have sickly sweet odor, aerobic gram-negative. It could be a few things, I'm not sure. Go to the top. 4 days after being admitted to the hospital. That's important, isn't it? That's considered being in the hospital. Hospital acquired versus nosocomial. Nosocomial in Greek means hospital. I also teach Greek like I teach a lot of my students, because medicine is a lot of Greek and Latin, right? So you'll learn a lot of Greek with me. 4 days after being admitted to the hospital for widespread second-degree burns over his arms and thorax, a 29-year-old man develops fever and wound discharge. So hospital, burn victim, fever, wound discharge. Also has 101 fever, 100 close to 102, discolored burn scar, edema, redness. All right. So a lot of you should know what the condition is. Yes? Yes. Now, you say to yourself, well, maybe I do not. Now, you have to think to yourself, what QBank are you using? Because UWorld doesn't help you. Amboss helps you. Because I know what the condition is. Do you guys know what the condition is? Pseudomonas. Yeah. Last 3 lines is an awesome study hack, right? Like we talk about. So, Pseudomonas. Here's the problem, ladies and gentlemen. Let's hit it. Attending tip. That's why Amboss is the best for me now and for all of you to learn. Then you use UWorld if you need to. This is telling you it's Pseudomonas because it's confirming with you it's Pseudomonas, right? 100%. Look at the answer choices. You're like, uh-oh, we have a problem now. The problem is we have all these different virulence factors, and I'm not exactly sure what Pseudomonas has. Now, those of you who work with me and work with me well know I have a middle name. This is a joke. My middle name is not Peep. But when you work with me, I let you and I get into your head and I teach you things so you don't forget stuff ever. When I took courses like you all have, Dr. Conrad Fisher, Dr. Goljan, Dr. Goyan, they taught me so much. To this day, 15 years later, I remember their jokes. I remember everything they did because it's the way they present. And that's what I do on my live sessions for my students that are members, and also my QBank video library that many students have access to. So you watch me 24/7 on demand to help you learn these little hacks that I show you guys, right? So PEEP, if you open up your first aid, PEEP is right here. Actually, let me see if I can, I don't think I can share that. But PEEP is P-E-E-P. Let me see if I can do this. Give me a second. P-E-E-P. Let me present to see if I could do another presentation here. If not, you open up your pages to 162. PEEP is this. PEEP is under Pseudomonas, and there's 4: phospholipase C, endotoxin, and green pigment. Yes. So what happens is this: when you have your when you have your questions, let me open this up again 1 second. Give me a moment. I'm trying to move around here so I can see my questions. There it is. When you have your virulence factors, you think Pseudomonas, we know there's 4, PEEP, right? So you know streptolysin O, power of elimination. This is strep. This is in the strep family. That's why strep pyogenes is a beta hemolytic. So this is out. If you guys don't use power of elimination, the problem is that you're thinking you're going to go into the exam. Now, this is more relaxed setting. I'm here hanging out on the computer like yourselves, jumping on your phones and laptops and devices. But when you're in the actual test center, 8 hours of an exam, 7 hours of 40 questions, stressed, a little nervous, performing under pressure, and it's your future because you have to pass step 1 to get to step 2. And this is all based upon, and this is all builds up to apply for residency. You might get a little nervous, right? So you are responsible to know this information. You have to not hope that they'll give you information that you know about. You should work on eliminating questions. This is what I do with my students, whether you work with me one-on-one, whether you work with me live on these sessions that I have Tuesday and Thursday mornings with my students, or whether I get on for an hour and I teach you with the consultation that I provide how you should do certain things so you have more leverage and more of an understanding how to navigate, right? Power of elimination. Protein A, Staph aureus, out. Boom. Alpha toxin, I know that's not going to be Pseudomonas. That's out. We have toxin B. Well, toxin A and toxin B is C. diff. Toxin A and toxin B is C. diff. Take this bad boy out. And tetanospasm, man, I know that's not possible. That's some Clostridium tetani, I believe, right? So by default, if you either know the answer, you know it's Pseudomonas, but this is what USMLE does. USMLE tricks you. That's an exam that's very, very doable with the right knowledge and the right resources and knowing how to conquer these kind of questions. You say, well, plan A is I know the answer, boom. But what if you don't know the answer? It's stressful, isn't it? So I teach my students how to have the confidence to eliminate, to say, you know what? I'm not sure what the answer is, but I know what it's not. And then all of a sudden, boom, it has to be this one. But look at this, 48% guys chose this. 48% got this question right. It's kind of sad, I think, because, I mean, not for nothing, I make it interesting to show you guys that I don't want you to go and learn tons of concepts. I want you to learn things that are either black or white, meaning clear. This is a drug, this is an MOA, and this is an adverse effect, right? Yes, this is the organism, this is how it presents, and this is what virulence factor it has. So then you could say, oh, this guy has Pseudomonas, which I know, but now after I read the answer choices from here to here, I then can appreciate the rest. Most of you don't do it this way, I know. And most of you read the answer and they move. Problem is 4, 5, 6, 7 months later, you forget what you read 4, 5, 6 months ago, and then you go back into the vicious cycle. See, but when I work with doctors and my students, and that's why I do this live to show you guys that everyone has usually issues at the beginning, but the more you can get to it and address the fact that you know what you need to do, the faster you get to it, the sooner you could take your exam, the sooner you have the confidence to take the exam and move on. Because I'm telling you right now, if you're just doing questions to do them, what's going to happen is you're familiar with the condition and the organism, but you don't know the virulence factors. And that's why 48% of people chose this. And the rest went to protein A. But protein A, as you know, is Staph aureus. Yeah. And toxin B sounds good. I mean, spoiler alert, or just to be honest, if you gave me 10 minutes, I can probably convince myself into most of these answers. Like, oh, this looks good. Toxin B, yeah, I think that's what it is. No, toxin B is C. diff. And a quick hack, a quick tip from me to you, toxin A, toxin B is for C. diff, A, B, C, D. And if you don't believe me that you should read the answer choices, you know what happens? This one here has toxin B. Yeah. You go to another question that has C. diff as an answer choice, and they might have toxin A instead. And when you read that explanation, they actually have a longer explanation that is a little more detailed than this one, which then tells me they don't copy and paste their explanations. They write the answer specifically tailoring what the question's asking. So the more you read, the more you, which people don't, the more you review, which most of you guys don't, the more you can learn and reabsorb information. And then those who are not accountable, they jump on my live sessions with my students Tuesdays and Thursdays, and they go, well, at least I could check in with you twice a week. Because then, you know, you feel more accountable, you feel more responsible, you feel more in completion of things. So this is AMBOSS. AMBOSS is really awesome. I love it just because I think it's a great resource. And this is just a little tip, a little show here, that these links here, all these 59 questions, my students in my course have access to. And every time I have live sessions, like I do every Tuesday and Thursday, before I do kind of like these live streams that you have access to me, students can access these links that I send them in my online community and are able then to do questions like this, because they don't really have to guess what to do. They have a study plan that I provide them. They have a set schedule. They have questions that we do together, and they have access to me 24/7 and my team, and we do stuff side by side, right? So this is what I do when you jump on board with me and work with me. And this is what needs to be done when you're working hard side by side, right? So please ask questions. I'm here to help you guys. I'm here to answer a couple questions side by side, whatever you have questions about. You know, I try to figure out, the more I can be available to you all, the more I can help you guys move forward. Residency is getting more challenging every year. And because of that, you know, we had 34 candidates match this year under our guidance and supervision. So we can definitely tell you how to navigate through that as well. But in order for you to get there, you have to physically pass step one, hopefully on first attempt. And then you have to physically get into passing step two and score at least a 245, 250 plus, right? And this is what we want you guys to do step by step, okay? This is the whole concept, is to push hard as much as possible and navigate through everything, you know? Awesome. Let me show you something else now that I got your attention. So this is, let's see. This is, here we go. This is my online community. So many of you always ask, so I'm going to show you what you have access to when you work with me, right? So this is basically now the online community that I have. We have online community here as a live feed. So anytime students have questions, you could jump on board. You could ask questions, participate, and move forward. I always communicate with all my students here. My team communicates with my students here, whether it's updates and all that. Live Zoom session is over here with our schedule of what we do each and every day, week 1, week 2, week 3, and so on. This is awesome. When we have our live sessions that we do with our students, everything is recorded and archived. So a lot of students ask me, they go, Dr. Stavros, you know, I'm overseas, I'm in Dubai, I'm in Asia, I can't jump on when you're available, when you do these live sessions with your students. It's okay. It's recorded and archived for you, so you can access anytime. This is the section here of the sets of questions that my students get, my AMBOSS questions that I provide to my students. Yeah. And this is a nice section, Med Students Q&A, where clearly we post pictures of how to get those extra points, showing you how to learn first aid more efficiently and effectively, learn how to read the information most effectively and efficiently, provide screenshots like this of how, you know, questions pop up. But this is the concepts that you should know of when you are taking your step, right? To then be able to be more effective when you're studying. See, most of you are just studying. Study. You don't have to study, man. Just randomly study with a purpose. Study with a routine, you know. And let me show you something else here. Let me see if I can access that here. If we go back a little bit to the community, let's see, to the meetups. You know what happened is they changed the profile here, the portfolio of the new platform that we use. which is awesome. So basically, this is where all our students go, access everything, and are available to connect with me and my team 24/7 anytime, which is awesome. That being said, they're able to then jump on board, because realistically, when I see you guys jump on here, most of you are working with me, some of you are not. Some of you just like to listen to me talk. So if you have any questions for step one, step two, let me know. Many students jump on when we work with shelf exams, NBMEs. Ideally, I want to be able to help you all, like, unfortunately, what I didn't have, in medicine, I have my family. They're not physicians. My sister's a hospitalist. Parents support me 24/7, like they did hers too, like they still do. But I realized in medical school, schools did the best that they could. We had students above us who showed us the way, but that was before we had any kind of social media. Nowadays, there's no excuse for any of you to not do well, but many of you are still struggling. Many of you are still not doing well studying for step one. And the reason why is, there's so many resources available, so many, right? And you don't know which ones. Everyone's using everything. So that's one thing. And the second thing is attention. The attention span, trying to sit down and study and reread things. So most of you study plan isn't effective. B, the resource that you're using really isn't best for you. So I do my best to help students out, to participate, to navigate them, to make sure that, especially the ones that work with me, that, hey, listen, this is what you should use. And sometimes I tell other students you should use something different. Then, like yesterday, we had our couple step two consultations. I made sure that the students that I worked with yesterday, that they had a study plan, they use the right resources. Some use this, some use that. Some are using UWorld, some are using Amboss. It just all depends. So if you have any questions, guys, jump on, ask a question or two before I jump off, because I have a busy schedule today. I'm in New York City for a few weeks, visiting family, and I have some meetings with physicians and schools out here, and then go back to the Midwest and then back to Florida after that. So I'm happy you guys are on board. Love to see you all. I'm happy you guys are participating and jumping on. Ideally, you need access to me, USMLEtrainings.com. You can reach out to us anytime if you want to jump on and watch jump on and really watch me do this live, as far as twice a week, every Tuesday and Thursday mornings. With my students, you can jump on and participate and be a part of our team, or just watch out for these live social media live streams when I jump on, when I have free time. Many of you need a little more guidance, so feel free to reach out. We can jump on for an hour and I can tell you, and I can guide you, at least instead of wasting 6-7 months of your life. You can then figure out, okay, he told me to do this, 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 and then eventually you're on the right track, right? Or if you're overseas, nice to see you. And if you can't jump on our live sessions, you can at least participate and watch us 24/7 with our QBank videos, right? So I don't see any questions here. So watch out for me. I do jump on sometimes Mondays, Wednesdays, Fridays. It really depends upon my busy schedule. I just wanted to show you a little bit of what we do, and to kind of provide you with some tips, some strategies. So whether you choose not to work with me, that's fine. Always remember, you need to have a study plan. You need to wake up every morning knowing what you're going to do. You need to know the resources that work for you. Remember, what works for some of my students actually work better for others and not as good for some other ones. So it has to be specific. And then Kelvin asks how much. Well, you can go to the website, man, and you can figure out yourself. I mean, we have things listed on the website. You could either work with me one-on-one. You can get the 1-hour consultation, or you could jump on like many students and have monthly membership and participate with our live sessions twice a week, have access to all the resources I provide, and also have access to the QBank video library that literally I have for you guys, because no matter what, you need to have a QBank. You need to have your first aid. And the problem is, you have a QBank, you have a first aid, and people are still failing, because you need something like what I have, the QBank video library, that shows you how to read the first aid more effectively, more efficiently, and how to navigate through these ridiculous questions, right? So Dr. Dukes, you can go to the website. Everything is listed on the website, doctor. That's why we have developers creating these websites for you all, to go visit and see exactly what we have. Study plans, videos I've created, which are orientation videos. If you are a beginner on USMLE versus you've been studying for a while, we have navigation videos, navigate you through step 1. We have samples of all our questions, immunomicrobiochem. We have study plans. We have everything that you need to get you going, because at the end of the day, you are saturated with so many resources. You have videos upon videos upon videos. All I create for you is what you need to pass step 1. I'm not here to dump more content on you. If you have issues with what you don't know what USMLE is about, we show you on that. We have sample questions on all the different organ systems, immunomicrobiochem as well. We have the study plan, which is specific for most of you. And then you have access to me. If you join, you get a 30-minute consultation with myself. So not only do you participate and join our monthly membership specifically, but also you'll meet me a half hour live so I can sit with you and say, all right, what's your timeline? What's your time frame? How long you've been studying and so on? Because this is what I believe. A study plan is great, but what we do is we provide you with a study plan structure, and then we meet with you individually to then make it more specific for you. That's the whole plan, right? Applying as a transfer student to one of the Caribbean med schools. Okay, so if you jump on board, reach out to us. We can work with you. A lot of Caribbean schools are pretty good. Some are better than others. So I know them all. I've worked with them all. I've attended one. My sister attended another one. So you can reach out to us. And if you're a part of our team, we'd love to help you, because you realize those who work with us, you end up joining a family. And those who do know me know that me and my team are always by your side to help you with step 1, step 2, getting into the match. And if you transfer into a Caribbean school, I know that school very well. I have multiple students in UHMS right now currently. So if you did join, then you'll be able to connect directly with students that are part of that school as well. So love to see you guys on board. Reach out, usmletrainings.com. Everything is there, guys. Whether you're going to jump on for the monthly membership, when you work live with me, have access to all my questions, or you just want 1 hour of my attention, I can work with you. Or if you need a little more one-on-one, we could do that too. At the end of the day, there is no excuse. You have access to myself, my team. You have access to the resources out there. You'll see me jump on 2-3 times a week. When it comes down to microbiology, like we talked about, watch this live session again. I gave you a little taste of what you can do. Don't overwhelm yourself with resources. Work on power of elimination. If you need more help, if you need more work with that, join our team, join our students, and we can help you every step of the way to become a better test taker, to increase your basic science foundation. And then guess what, guys? The more you work now, the more you'll be able to pass your step in more of a time frame. And then when you transition to step 2, there's your 250 plus. All right. Thank you all for joining. I got to go. I have a session in 10 minutes, and it was wonderful seeing you all. Watch out for my next live stream. Might be tomorrow, might be on Monday. You just never know. Got to be by your phone to get that notification. All right. All the best. Can't wait to work with you all. I'll see you guys soon. Ciao.